my side of bed.
Hey everybody, welcome back to Sergeant's Talk TV. I'm Big Mike.
And I'm Jason.
Yep, Jason's still in Tennessee. Well, you just got back to Tennessee, right?
Just got back to Tennessee. We took a much needed, well enjoyed trip and got to see all 5 of our grandbabies on one trip.
Well, good.
We were talking about it on the way home, and it was like, there hasn't been a trip with the grandkids being born and how they've been staggered that we've been up on one trip and been able to see all 5.
Right.
So this was the first time that we got to see all 5, and we only missed out on seeing one of our children that was up there, and he wasn't feeling well, so didn't get to see him, but got to see the rest of them. And very quick trip.
Kids are growing like the weed.
Oh my gosh, they are. You talk to them on the phone, they'll do FaceTime, and they do so much, but then you see them in person. And all of a sudden, they start talking to you like in sentences.
Right.
And you're like, wait a minute, you're 5. What are you doing? Like, this isn't no stop. Like, what happened to I got to make up what you're saying? The littles are still that way. We just make up in our head what they're saying. But, yeah, for the couple that are older, the 3 older ones, it's like, wait a minute. Whoa, hold on. Yeah. Starting to give me more gray hairs.
That's good. Hey, so tonight we're going to be talking about Tricare versus VA healthcare and what's the difference between and which one's best for you. Okay. If you've seen the thumbnail, it can be confusing. Not as confusing as Medicare Part A and B and D and C and all that other garbage, but it can be confusing when you should use one, when you can use the other one, and so on so forth. So that's what we're going to talk about today. You get a lot of people asking a lot of questions on, hey, why should I leave Tricare and go over to VA healthcare, and vice versa and stuff like that. So we're going to talk about that tonight. Hopefully we will put some thoughts in your head. And remember, I have pinned the link up on top. If you want to join us on panel to talk about all this stuff, you're free to click on that and come up on panel, and we'll make you part of the conversation. But before we do that, let's say hello to the people that now pay the bills. We have hit our 1K. I think we're at 1,161, and we're over 4,000 in watch hours. So I just did the 2-step verification and stuff like that. And when they're ready to send us the stuff, then we will finally be monetized. And anything that we make off this channel, if we make anything, will be going to the McAllister Homeless Veteran Shelter here in McAllister, Oklahoma. So, plus we get to do this every Tuesday night. So yeah, I'm happy about that also. It helps me out a lot. Just talking about things like this and helping other veterans. That's what it's all about. So I want to say hello to Anna Bohr at Homestead.
Hey, Anna Bohr. There's our brother, Reverend Dream, making it in.
Yep. Our flipping farmstead. That's Dawn, my favorite female Marine.
Always in here. There is Dana Mason saying that Stella, my BFF. Hi, Stella. They're all watching and lurking there. So,
yeah.
Awesome. Glad that they could make it in.
There's Neil S. saying hello.
I see Debbie Drock made it in. Oh, yeah. I think we clicked at the same time. I'm not going to click.
Okay.
There you go.
There's the Sergeant Major. She's been recovering from almost a 3-day migraine.
Not fun. All right, we'll promise not to shout really loud and get agitated.
Yeah. Let's see who else is in here. There's Judy Herman. Hello, Judy.
See Charlene Grady up on the Cape made it in. Hello, Charlene.
And there is Linda Peterson. Linda Peterson.
See brother Chris, so Mr. Leonard Mountain Homestead made it in. Glad to see you, brother.
Did we say Charlene Grady?
We did just a minute ago, but we'll say it again because Charlene is awesome.
Angie. Angie. My favorite VA nurse is right there. Yeah. Who else is in here? Let's see. Going down. Hey, Rainy Ridge. That is Eric and Tina. I just learned that.
Oh, really? Yeah, and their daughter Jessie, she comes
I
up
knew
as
their
the
names,
dog.
but I always get it wrong. And then I got to say it. I just say it to myself time and time again. And then boom, now it's in the old hard drive.
I will tell you, oddly enough, so I'm normally horrible with names. First meeting of somebody, like I typically won't remember their name if I've only met them once, and then it's a
Right.
while and we go back and it's like, hey, I'll remember your face all day long, but a
Yeah.
name. But since starting YouTube and getting on and doing live chats and stuff like that, and especially for us doing the live, because it's one of those like you get up on a panel, whether it's on our channel, somebody else's channel, something like that. Like it's always nice to know their first name, right?
Yeah.
So I've gotten better somehow because I can associate their channel name with their name and then it just clicks. But
Right.
if I meet you in person on the street and be like, hey, how's it? I'll forget it. But
See,
I somehow, whatever reason.
here's something. When you start getting older, okay, there's a game called Mahjong, where you match up
Yep.
stuff and see how fast you can do it. I started doing that. It doesn't make me remember anything more or less, but I do it anyway. But when I say their names over and over and over for a while and I block everything out, then I remember it. Call me
Well, and I
weird.
think like I've normally been pretty good about like if I write their name down. Like if somebody I meet somebody the first time, if I have to write their name, um then I'll typically remember the face to the name when I wrote it down because I'll look. But if we're just having conversation and I didn't write it down and I didn't have to say it a whole lot of times, I'll typically forget it. Um, don't know, but I think because being in chats and doing that kind of stuff, like there's a lot more interaction um, through here. So
Right.
and it's always one of those. I think doing comments really helped because then you can like associate who that person is and what they're doing.
Right. Hey, Rebecca, Touched by Yarns in here. How are you doing? Tony, there's Tony, our cabin in the
brother.
He's in here. He just
They
put a video, a short.
they might enjoy this then.
Yeah, and the chickens are getting older. They're all feathered out. They're looking good. And Terry said, anytime you want more eggs, she will give you as many eggs as you want, Tony. Because I think they want to hatch out some more eggs. And there is Brian at the Vineyard Farmhouse. Let's see. Scrolling.
Yeah, I'll throw this one up there from Annabelle Robin. So yeah, some are just hard to forget. But I'm not sure. I hadn't figured it out. I was actually thinking about that the other day, in all these miles of driving.
Yeah, it's muscle memory. That's right.
Yeah.
And we're at the bottom. We got 22
We
people
are.
in here. Hey, so
They're
guys,
telling
the yeah, I need more eggs. The first question a lot of people might want to ask if you're a veteran, can I use Tricare and the VA together? Right? And that's a question a lot of people go, okay, I'm retired military. Not everybody's retired military, so they don't get Tricare, but they do get VA healthcare. But if you get both of them, I mean, the good question is, can I use both of them together?
the quick, easy answer: yes.
Yeah,
Um, Tricare is just another healthcare option for service members that they get for retiring from active duty or from National Guard and Reserve service. Um, it's just like or similar to like Blue Cross Blue Shield, or if you live in rural places, sometimes the benefits you're able to get wherever you need at your own convenience.
yeah,
Um, yeah, and but that is kind of the key though, is the Tricare portion. I know like we've talked about it because Mike and I are both retired. So we get to, I guess, double dip for easy way of saying, right?
right,
We get covered both ways. We get covered VA, but then we also, if timelines or whatever, like we get a choice to use VA or Tricare, depending on our situation. But the only way to get Tricare is if you're retired
right.
from military. So it's not something that you can go and like buy. Um, and I know actually the additional, I know it's, but the additional, like my dental and vision, because that's outside of the dry care, is actually through Blue Cross Blue Shield. So,
Right.
um, oh, I see Devil Dog made it in.
Yep, he's here. So now, if I'm at a VA facility or you're near a VA facility, I always head in there for my medical needs because we have a clinic right here in McAllister. If I'm out of town or maybe I'm on leave or wherever I might be, and I have the option of going to a private doctor. So you have both healthcare plans and you can utilize both of them. And again, at my convenience, like you said earlier, it's whatever suits me best at the time. So I know a
Yeah.
lot of times, for example, when I first moved here, I wasn't into the VA system as far as the Oklahoma VA because you got to register in each state. So I had Tricare. So I went to a civilian doctor, and because I had this shoulder, I had surgery on this shoulder when I was over in Korea, and I had that done at Yongsan Medical Center on the military base. And when I got here, this one was doing the same thing, and I was under the knife. I went in there. They sent me for an MRI. I got that done. I went to a specialist in Muskogee, and within 8 days, shoulder was all fixed. And I had that all done under Tricare. I paid $25. My copay when I went to see him each time was $25, and that was it. So that was kind of convenient. And the good thing is about Tricare, if you're a retired military, I think now it's up to like $410 a year, and they take it out of my military retirement pay each month. They take a little bit out, and it's paid off by the end of the year. So, where in the world can you get health care for $410 a year?
Yeah.
Okay, other than Tricare. So that's kind of convenient under those circumstances. Or like I said, you might be on leave somewhere and something happens to you, or you get sick and there's no VA around. You can just go to a private doctor, and hopefully they take Tricare because Tricare is really Humana for
Right.
where Oklahoma
And
falls in.
I've found over the years, like Tricare is getting accepted in a lot more places now.
Right.
Um,
Well, it's
I
not really
remember,
Tricare. It's either Humana or whatever region you're in, and they've negotiated a contract with uh,
right,
insurance.
but it's got to the point where they know now. Like I remember the first time, and I was still active duty, um, and I had a son that was seeing civilian doctors for specialty stuff,
Right.
and most of them didn't even know what Tricare, Humana, any of that. Like when I mentioned, hey, I'm an active duty Marine, like I have health insurance, and they're like, we don't know what that is. Um, and I'd also found out when because I did that, kind of trying to stay where we're going. I
Right.
did use Tricare and the VA on the same visit, well, in the same town, because I was on vacation down to Corpus Christi, and I'd gotten sick and I ran out of meds. Well, when I got sick, like I had like pink eye and double ear infection. I was all tore up, and I fought it for like 3 weeks with over the counters. Couldn't do it. Got to Corpus Christi, and I thought, hey, I'll go to the hospital there. Well, their hospital on the base doesn't take outside patients. They're for like the training staff because it's only like a
Right.
training base now. And so I called the Tricare number and they said, hey, there's a walk-in clinic out in town. Here's the address. Go see them, make an appointment, blah blah blah. So I did, um, and actually I didn't even have a copay when I went in for that one.
Right.
Um, but then my meds ran out, and I was like, okay, I need more meds. Well, then I found out because at this time I didn't know there was a VA clinic in Corpus Christi. So then I went to the VA clinic and I'm like, hey, I've went to this walk-in clinic. They gave me some stuff, but it's not doing anything. Like, and of course, that one being at the VA clinic was totally free. And I was able to get my meds there at their pharmacy instead of at the time we were living in Michigan. And the first time I tried to order them, they shipped them to Michigan. And I'm like, that doesn't help me in Texas. Like I need
Yeah.
um So, but the good thing between the Tricare and using VA is they don't fight. They don't argue with each other on, um, who's going to cover what. And so, the good thing is the bill gets paid by one or the other side, and we don't get stuck with a bill. That's
That's the key.
that's the biggest key right now
You don't
is
get stuck with
we
it.
don't get a bill like a big huge bill because they're like because whether that doctor's office knows it or not. And one lesson that I learned early on was when you're in a region that isn't used to dealing with a lot of younger military retirees on Tricare,
Yeah.
you've got to let them know you're not on Tricare for life.
Right.
That's a totally different version. And I did run into an issue early on with that was I was seeing a civilian doctor before I could get into the VA, just moving back to Michigan. And they called me and they said, hey, these are getting denied. And I said, what do you mean they're denied? And they're like, yeah, they're not. It's saying you don't have coverage. I said, oh, yes, I do.
Yeah.
So I was talking, as I'm talking to the lady at billing, she's like, well, yeah, I said, well, how did you put it? I think they were still calling it Tricare Standard or something. They've changed what they've called it, 100 times. She goes, no, I submitted Tricare for Life. I was like, whoa, okay, stop. That's why you're having an issue. I said, I'm
Yeah.
not old enough for Tricare for Life.
Yeah.
That's for 62 and older, Social Security. Um, yeah, that's the only time we have an issue.
Yeah.
Right. And that's fine. But if you're in an area like I was, where pretty much the only ones they dealt with were the Social Security older retirees that were on Tricare for Life. They didn't know there was you know, hey, I retired as a baby, so I need the baby version.
Yeah. So, for example, here's my bill, all right, for my surgery. And that's what they did in the hospital. That's what they did for me in the hospital. And that's what they did for me in the hospital. And that's just Monday and Tuesday. They let me out on Tuesday at 3 o'clock. Actually 2 o'clock. I got out of there, and they billed the VA $35,163.28 for my left hip replacement. So the VA said, well, really, that surgery only cost $12,355.42. And that's all we're going to pay you. Right. So the difference is $29,038.08. Now, amount paid by veteran, zero. Okay. Amount paid by other insurance, zero. So they only paid a little over $12,000 for a $35,000 operation. Well, if you had civilian health care, right, your insurance might have paid a little bit more than $12,000 or whatever. But the difference between what they want and what your insurance bill has is your gap. And then you're responsible for that gap payment unless you got that duck stuff or whatever that thing is, or the duck, you pay the gap insurance.
Oh, the Aflac?
You have to have insurance on top of your insurance to pay for that gap insurance. And who knows how much of the gap they're actually going to pay, right? So when you have VA health care, they're only paying the Medicaid or Medicare part of what something actually costs. And they got a laundry list. So, for example, what they did in there, they didn't pay for no medicines, nothing. They said, hey, we're going to pay you for the surgery. They have like 2.5 pages of medications and whatever they use in the operating room. And they said, we're paying for the operation. And that includes my physical therapy and my home health care nurse. That's what we're paying you for. That's it. You're not getting anything else. Okay. So if you look at it that way, you can see how out of whack healthcare is in America. Okay. So somehow they have got to get this healthcare thing under control, because they can bill you, they can charge you whatever the heck they want. You know what I mean? I mean, I got billed, for some reason. I went in there for my first surgery and they did an EKG on me. They got to check your heart out before you go under the knife and stuff like that. So they paid for everything except for the, those little things that they tape onto your chest and they pull all the hair out.
Oh, the little electrode.
The little electrode things. I got charged for that because for some reason they weren't getting the amount they wanted from the VA. So for some reason they had my Tricare on file at the hospital. So they charged Tricare saying, hey, we gave them an EKG, and then Tricare paid for that. But I got stuck with $7.79. So I just went ahead and paid it. And I went in there this time. I said, well, why didn't you the VA didn't? They go, what are you talking? They look back and they go, oh. I said, well, you can keep your $7.79. I don't need it. But just kind of, they will go after anything and everything, because the VA doesn't go and say, okay, you have Tricare, so we're going to make them pay for something, then we pay for it. If you use Tricare, Tricare pays for it. If you use VA, VA pays for it. So if you go into a hospital and they always ask you, what other health insurance do you have? And if you list something, they're going to see who's going to pay the most and then bill the other one for the other part of it. You see what I'm saying? And a lot of times they won't pay for it. Like I went in for an MIR back in 23 and they're trying to bill me for it now. And I said, well, wait a minute. The VA ordered this. Why are you billing my Tricare when the VA ordered it? It's just, it was the first insurance they seen when they went to the billing And so they just charge them because they know they'll get more from Tricare than they would from the VA. So we're trying to work all that stuff out. So as a retiree, I have Tricare for life. And that's me personally because I'm over 60. But I can also use my VA health care. And if I think another uh, important or similar to other forms of insurance, Tricare is not paying for hearing aids. They're not paying for glasses if you need them. Now, they'll pay for the testing of your hearing test and your eye test, but they're not going to pay for your glasses or your hearing aid. So in that case, I use VA healthcare, and I went in there and I got my hearing aids through the VA. I went on the 13th of December, and they got them in because they had to fit my ear holes and stuff like that with that. Now you're talking a $4,000 pair of hearing aids, right? With the charging case and all the stuff, and you get an app with it, and you can control everything through the app on your hearing aids. It's hooked to my phone. It's Bluetooth, everything. So they're like $4,000. Now, if I only had Tricare and I didn't have VA health care, and I'd be going without hearing aids. There's no way I'm going to pay $4,000 for a pair of hearing aids. But I used VA, and VA pays for everything, pays for glasses, pays for hearing aids, pays for all that stuff. Sleep apnea, they pay for your CPAP. They do all that stuff for you, and it's all paid and it's yours. And since I have diabetes, type 2 diabetes, I've been getting this thing called neuropathy in my feet and stuff like that. I go to the VA, guys, and VA makes every 6 months, they make me a pair of shoes. I go through this catalog and I choose what I want, what colors and styles and all kinds of stuff. And I mean, that book is like this thick. So they give me a pair of tennis shoes. They're dress shoes. You can wear them with suits or whatever. And they're like $269 a pair. And I get a free pair every 6 months because of that condition, because I'm 70% disabled, because you get full health care once you hit 40%. Okay, all your medications, everything is paid at 40%, and you don't have to worry about none of that stuff anymore. Now, I will tell you that that's a lot of money for hearing aids. I just had, like I just told you, I had my hearing done and all that, and the savings, and that's why we're saying choose your medicine or choose your weapon whenever you're going out into the civilian community, or if there's the VA there, choose which one you're going to use that's most convenient for you, and the one that you're not going to pay anything for. So that's a good thing I want to put across to you. A lot of people are putting off, well, I really don't need, and I feel kind of weird that I'm not doing, if I go and do VA healthcare, blah, blah, blah. But when you get my age, okay, you may be 40 years old and retired, or you served in the military, you didn't retire or nothing, and you're getting up in age. You need to get it now at 30 and 40 and stuff like that. So when you do get up there, I'm telling you something, guys, once the truck's paid off, everything goes to hell in a handbasket, and you need that kind of help later in life because it's expensive. I just don't know how these young families are doing it with 3 or 4 kids, and they're in their early 30s and they're paying tons of money for insurance on a family plan. You know what I mean?
Yeah, that was really a big driving factor. And sorry for blopping out, guys. Internet was being a little cranky. Um, that was one of the big keys that I factored in when my first reenlistment came up, because of course, they assigned me the job they wanted me to do, not the job I wanted to do.
Right.
Well, MOS wise, I was good, but when I got to my unit, I wasn't doing my MOS. I was doing, an external. So I said, no, I'm done. Well, I started figuring out at the time, being married with two children, what it was going to cost me in healthcare. And I'm like, I can't afford to get out. Like, I need to stay in to get, keep this medical
Yeah.
coverage.
No matter
And
how
then the
miserable
benefit,
you were.
yeah, like, and it eventually got better. I mean, I knew with promotions and being around longer, things. But that initial, when you're young and you're just, you're getting promoted, but it's not going where you thought it should go. And I'm grateful I did. I had the patience at the time to just say, you know what, I'm going to tough it out. And I know in the long run, um, and yeah, I mean, like you said, like here, I'm 44 and fully retired,
Yeah.
and yeah, some of this stuff I might not need right now, but I know I'm going to need it later. And the fact that I have, if I can't get service,
Get ready, guys.
oh my gosh,
There you go.
I
So
just
yeah,
reset it. But
Devil Dog, you're right. You can't get dental unless you're 100%, or if it's a service connected because you had an injury. Let's say you were in a APC and you had all your teeth knocked out when you're out in the field or something because of hit going into a ditch. I had a friend lost all his front teeth hitting the turret when they were out on training exercise at Fort Carson. And so, yeah, you can get it if it's a service connected disability, and if you're at 100%. And there's a lot of videos out there about dental. If you go up there and you see home, when you go to your home page on your YouTube and you hit home and you get to see all the videos and stuff, and you can choose, and you just hit VA and all the VA channels will pop up. And there's some channels out there that have detailed information about the dental plan. And I think that if you have the dental part, I know that Delta Dental is associated with Tricare. I don't know what the VA one is, but the VA will pay for that. So, and
yeah, because
either those are a bunch of crooks too. Sorry.
oh gosh, yeah, um, I actually didn't have dental coverage for the longest time.
Yeah.
It wasn't until, because when Tara and I got married, obviously I could put her on my Tricare. She's not going to be able to use anything at the VA, but she can use Tricare. So I get that. And
Right.
that was kind of our next note, was talking about Tricare being an option for a lot of people, because if you've got a family, even if it's just a spouse, like when Tara and I got married, all of our kids had aged out of the system. But just for the two of us to have it, um, and if you've got a family and well deserved, so that's your opportunity to have your family on a healthcare plan that's not costing you or costing very little as far as premiums and things go. Um, there is an enrollment period to get on the dental. It's a dental and vision program all in one. That's separate from Tricare. It's not an automatic, and it's not straight through the VA. For the family plan. And
Right.
so you have to sign up during the enrollment period. But my dental is actually Blue Cross Blue Shield.
Yeah.
So
So they actually, I think it's 369 for the single plan if it's just you and you're not married and you don't have kids or nothing like that. And it's like 410 or four something if you want the family plan, like it's just Terry and I without kids. It's a little bit
okay.
more if we had kids and stuff like that living at the house that was of age. But I strongly encourage any veteran, if you're on Tricare If you're a retiree from either, like we said before, remember, you can also, if you're retired, or you're active duty, or your guard, if you're retired from the active duty, or you're retired from the guard or reserves, because those guys are eligible for Tricare once they start drawing military pay at 60 years of age. Depending on the number of deployments you have, you can have up to 4 years deducted from 60. So they'll give you, if you're guard, if you're guard or reserve, and you have 4 years or more in deployments, then they will subtract up to no more than 4 years. So at 56, you can start getting Tricare insurance. Okay. So the eligibility, and you're drawing your retirement pay as a guard or reserves. And I don't really know how that works because I've never been in the guard or reserves. But I'm sure you can retire from that if at the age of 60, and you can start collecting it 4 years prior if you have deployments. And there's a lot of guard and reserve that have, 3 or 4 or more years in deployments after that 20-year war that we just got ourselves out of. You know what I mean? Plus, before that, all of the Iraq portion too. So you got to remember that. So you are eligible for Tricare if you're a guard and reserve under those conditions. All right. Is he sleeping?
He froze.
Is he froze? Boom. Oh. So a lot of folks then opt into that portion right there. But at the same time, I would strongly encourage you to either utilize the VA or continue to use it, because as we talked about before, you don't have to pay nothing under VA healthcare. There are so many options that are available through the VA that's not readily available through civilian providers on Tricare, or will cost you money using Tricare. Like I said before, you may get stuck with a gap payment. With the VA medical care, you don't get caught with no gap payment at all. Or you don't have to pay a copay for nothing if they send you to a civilian doctor, like I did with my hip, or both of my hips that I had replaced. I didn't have to pay nothing. They pay for everything. And that is the biggest piece that Tricare will have for you, is the copays. And then you might get caught in the gap situation because the hospital is demanding whatever, and they're only willing to pay that. Okay, so you got to remember that. Now, never forget that you've earned these benefits, and you don't have to worry about which one you can use. But just remember, if you utilize Tricare, you're going to different places for different things, and it's not a one-stop shopping like you do with the VA. Okay, so for example, I have a thing which is very convenient, is community care, because where I live, in retrospect to the hospital up in Muskogee, it's an hour and a half each way, so I'm eligible for that. And what they'll do is they'll say, hey, we want to do a podiatry appointment for you because you have diabetes, and when can you come up to Muskogee? I say, hey, I'm on community care. And they go, oh, I'm going to send this over to community care, which is another department of the VA. And then they will set up the appointments with the provider. And then what they do is community care will call me and say, okay, what are good days for you? What times are you good? Are you good in the morning or in the afternoon? So on and so forth, because they don't know if you're working or not. And since I'm retired, it doesn't really matter. And then the next thing I know is a civilian doctor is calling me that takes the VA's money and says, hey, we'd like to set up a podiatry appointment for you. And then I go to the local doctor and they take care of everything. Now, they may say, hey, you need arch support or whatever. They send that back to the VA. The VA say, hey, we need you to come in. And that's when I'll have to go to the hospital in Muskogee, put my feet in these crush boxes, and they get a thing of my arch and all that, and they make those things for you, and it's free of charge. And that's the same way with the shoes. You can get dress shoes, you can get work shoes, you can get both, depending if you're working or not. I didn't get the working one because I'm not working, but they'll do that for you. And the same thing with eyeglasses. I went to a civilian doctor here. They said, this is how jacked up you are. And they said, we'll send this back to the VA. So now I have to go up to the VA because these are just Walmart classes because I need something to read and stuff like that. But my prescription was sent back up there to them. And then I go up there, I pick out my frames, they cut the glasses, they do all that stuff, and they give you a pair of glasses, which I don't know what it costs at a optometry office and stuff like that, but I'm pretty sure it's not cheap. So I get that done, and it's 100% paid by the VA. I had back pains. I still have to go up there, and they're going to issue me a TENS unit for your back and stuff like that for muscle spasm and things like that. So the VA is, like it says, one-stop shopping. Now, if they can't do it, they farm it out, just like orthopedic surgeon and stuff like that. They farm it out and stuff like that. And they told me, they said, hey, do you have a doctor in mind? I said, I don't know any doctors and stuff like that. So they bring out the list. Now, I did see Dr. Gannon for a special look and stuff like that. And I remembered his name. And then when they started bringing up doctors in my area, he was at the top of the list. I said, well, I know that guy right there because I went in there for a consult. And they go, oh, yeah, he's number one on our list for your area. I go, oh, wow. So I hit the jackpot, and he did a great job. I mean, great job. And he understands he's not going to get paid what he wants for the VA because I talked to him and stuff like that. And I told him I talked to him about on our YouTube channel. And he goes, oh, what? I got to watch that. And so, yeah. So it's a good thing, the VA healthcare, and you can't beat it. I'm telling you guys. So if you haven't signed up for VA healthcare, you need to go on and you need to go to either to your local VA, especially if you have a hospital near you or a clinic, or go to the DAV, and they will hook you up with getting enrolled with VA healthcare. I know with the VA, it's a whole team approach where everybody's talking to each other because they're all on the same systems, and you're not jumping from this clinic to that doctor to this hospital and stuff like that, like you would do on civilian insurance and stuff like that, because you're all over the place. So you go to the hospital at the VA, and it's a one team approach. And if you live around Muskogee, Oklahoma City, or wherever there's a hospital, you can get everything done there. You don't never have to go to another doctor whatsoever. And it's just, I mean, they got the blue team, the gold team, the silver team. It's a really good system that they have in there. Now, it does take a lot to run a VA, guys. It takes a lot of money to run a VA. And like I said before, the government has no business running the medical a hospital or anything like that because it costs so much to operate when the government runs stuff. And I will tell you that if we said on our video, our live stream before, that I don't think that we're in jeopardy of losing VA healthcare as we know it. It's already been funded, and the Senate just approved everything, and 2025 is all taken care of, and things like that. But I do think that we might experience it being turned over to the civilian sector. And what does that mean? That means a lot of people, good people that's been working for the VA for years, might lose their job, or they have to go find a job at a civilian hospital or whatever the case is. But there's a lot of senators that didn't vote for it, and there's a lot of them, guys. And in the future, we might see it go privatized. I don't know, but I just have a bad feeling that it will be privatized at one point or another. Let's see. Now, Tricare is a wonderful benefit, as we talked about. It's insurance that your time in service and your retirement from the service has earned you. And what I really like about it is that it covers your entire family. Okay, because everybody knows you got to fill out that piece of paperwork and show that you got insurance on your family or on you or whatever. Every time you do your taxes, you got to submit that with it, right? But with Tricare, it is covering your entire family. You may have VA health care, but at least your family's covered if you're retired from the military or the Guard or the Reserves. So that's a good thing, and it's something. So I don't have to worry about a separate healthcare plan for the rest of my family. They can be on Tricare, but it's like any other insurance or hospital or whatever that accepts it, and that's what you got to really look at. Who accepts your medical care? But you're going to find that out real quick. And sometimes you got to travel a little ways for some kind of specialty care for someone who's actually going to take your insurance under the Humana or whatever. But with Tricare, there's none of this in or out of service providers and stuff like that. It's just whoever takes it. And if they take it, then they pay whatever it's going to cost. Okay. So I don't know what happened to Jason. Hopefully he's banging his head up against the wall somewhere.
They're trying to get back in.
Oh, are they? Okay. I didn't see it. Hey, there's Pacquiao Mearns. How are you doing, Mearns? Bobby over at Betty Jean River Homestead. I'm glad you came in here. And Grayson Fire, there she is. There's Glenda. Yeah, and it's good to establish a PCM for both VA and private healthcare. When VA does not cover something, it's important to have a backup plan. Like, again, they don't, I know in Muskogee, they don't do orthopedic surgery. So, but they do have a list of them that will take the VA insurance, okay, or the payment from the VA. All right. Let me see what else we got on here. And so, for example, VA healthcare. If I go to San Diego, I get the same health care as if I go to Muskogee. Okay. If I go to Edwards Air Force Base, I get the same health care. If I go to Fort Carson, I get the same health care. I'm still covered under everything, and it's done like that. But if I'm with Tricare, it depends if you're out of zone, if you're out of whatever. It just depends. But the good thing is you have Humana or whatever your region. We just moved from the East region to the West region, and now we went from I don't know who it was over here, but now we're in Humana out in the West come 1 January, I believe it is. Isn't that right, Terry?
Yeah.
Yeah. And so now I have to go, if Terry uses it, she has to find out who takes Humana. Most everybody takes Humana. It's one of the biggest healthcare around. So she doesn't have to worry about that. But the good thing is that if you're on vacation or anything like that, you're going to get either VA healthcare done if it's for me, or for her, we're going to have to find out who takes it. Is it in pocket or out of pocket or whatever those words are for healthcare and stuff like that. If they're in your program or you're not, and so on and so forth. But it's VA healthcare that if you're eligible, that you really want to use. It is one of those things where you don't have to pay for prescriptions. Because if I use Tricare and I go over here to the Walgreens or CVS, there's going to be a copay. I'm going to pay for something. Now, if it's something like really expensive, like Jardiance or something like that, it could be very costly to use the Tricare. So that's why I use the VA healthcare for things like that. If you're on a drug that's like really expensive, even if you have your insurance is paying for a certain amount of it, then you get stuck with the rest of it. VA healthcare might be the answer for you. And that's what you got to really think about, guys, is what is best for you. Okay. And in my case, for this area, I can't beat VA healthcare. There's no way, unless I get aggravated with them and it takes a year to a year and a half to 2 years to get whatever they've diagnosed approved for surgery or whatever. If I go over there and I weigh my options, I said, okay, how much of this are they going to pay for my shoulder surgery? Because I had to have it because it was ripped and torn. They paid everything but the copay. And I was absolutely happy with the doctor that I got that covered my health care through Tricare. So you got to remember that. But guys, if you're a veteran and you have not gone and enrolled in VA healthcare, you're doing yourself a disservice. Okay. I hear people go, well, I'm happy. I've got insurance and blah, blah, blah. And it may be cost you the same amount of money because of the rest of your family. I get that. But what about all that out of pocket cost? If you're a veteran, you can go to your civilian doctor and you just tell them, say, hey, can you send that to the VA? And they've got it. It's on hand because everybody takes care of a veteran. Everybody knows a veteran. And that's all I do is I said, hey, send it to the VA, and then they mail it out. Because when they call that in, everything comes out of Dallas, okay, to their central filling facility that they have in Dallas, the VA does. And that's where all the drugs come out of. And it gets mailed to your house out of Dallas, Fort Worth. When you, like, if you renew a prescription, it ain't coming from your local one. It's coming from Dallas, Fort Worth. So those are the things you got to understand is there's some out of pocket. Do you want to pay $4,000 for hearing aids when the time comes? And why are you waiting until you get old to say, hey, now it's expensive when you could have already been in the system a long time ago and not paid for glasses, not paid for shoes, not paid for a CPAP, not paid for hearing aids and stuff like that. So I implore you to really look into it, talk to your DAV, go to your local VA if you have one by you, or a clinic to get more information and how you're going to register. The DAV will help you register for it, guys. Okay. The DAV will help you do your paperwork depending on how much disability you have. Like me, I pay $5 for my Jeep Grand Cherokee and my Harley Davidson, $5 each for tags every year. instead of the registration cost. Those are the things that the DAV can help you with, okay, because you're a veteran and you have a disability. So you just think about that, guys. Do what's right for you, but if you're not doing it, I'm telling you, you're doing yourself a disfavor. But that's what we have for you tonight, guys. A little bit of information to make you dangerous. If you have any questions for us, we'll be more than happy to answer those questions. You can send it in an email, and our email is in the About section. I did put in there let me get rid of this real quick. I believe I put, yes, I did. For more information about Tricare, there's a website that you can go to. And for more information about VA healthcare, I put in the va.gov website also in the About page, and you can go to that. So does anybody have any questions for me? Let's see. Okay. See, Devil Dog. To answer your question earlier, I'm 100%. Yeah, so you need to look into your dental. Yeah, and congratulations. Oh, no, that's White Rock said that. I'm sorry. Because he's 100% and he's got dental. So, yeah, Devil Dog. Got it mixed up. I seen Devil Dog and I didn't see White Rock. And their internet's all dorked up. Yes, you have a Merry Christmas also, Neil. Yep, Congress Bill 542. Yep. Let's see. And guys, there's so many VA channels on YouTube. And somebody, all you got to do is just put down VA and then ask your question. And somebody has done a video on something. Trust me. So, yeah. So I don't see any additional questions. Let's see. Nope. So guys, that's what we got for you tonight. I wish Jason could have been up here. We still have about 3 minutes left. Guys, hey, Christmas is coming up. I wish everybody a Merry Christmas. We will have a live next Tuesday. And next Tuesday, we're going to be talking about let me find it. I want to make sure I tell you the right thing. The top 10 VA disability myths you should stop worrying about. Okay. We got a top 10 list of things or myths that people have just blown out of proportion. And we're going to talk about that. And some of it is, if you've been around a while, you go, wow, how can people think that way? But a lot of people do that's never been into the VA healthcare. They hear all the war stories and stuff like that. But we're going to set everything straight next week with that top 10 myth. Okay, guys? Hey, I'm glad you guys came in. Remember, be kind to one another. Help somebody in need. And always, always think of that. Guys, if I don't see you next week, have a blessed Christmas and a happy new year if we don't see each other again. Because I know a lot of people are going on vacation and visiting friends and family and stuff like that. So, guys, we love you. God bless you. We'll see you next time. Bye, guys.